Hello, everyone. My name is Charity Campbell, and this is my presentation on my research of women's attitudes towards birth control. Birth control can cause women many problems. These problems can be both physical and mental. The use of hormonal birth control can affect every woman differently. While there is plenty of research on the medical information regarding birth control, there is not substantial research on the attitudes women have towards it. The hypotheses for this research focus on attitudes towards birth control based on weight and age. The design used in this research is correlational. Participants from a university were asked to complete a questionnaire. A survey platform was utilized to ask questions regarding attitudes towards birth control. The outcomes were examined using a chi-square test to determine if there is any significance between the independent and dependent variables. The results found that age and weight have no correlation with attitudes towards birth control. The key words in this research study are birth control, weight, and age. The overall question of this research is, what are women's attitudes towards birth control? This research is relevant and important because plenty of information can be found on the medical side of birth control, but there is not much research on how women feel about it. In this research, the term contraceptive is used to mean any method of birth control, including medications and devices. The term IUD refers to an intrauterine device which is inserted in the uterus. Further, the term oral contraceptive is used to mean any birth control method taken by mouth. Birth control has been known to have numerous side effects, including mood swings, headaches, and weight gain. Every woman does not experience the same symptoms. This research focuses on the effects of birth control by weight and age. A study by Rowe states the following: both of these progesterone only birth control products are considered very safe in the short and medium term, but there is still uncertainty about long term effects on bone and cardiovascular health, and some people are still wary of the potential for coercion in their use. This statement gives insight on why more women may be opting out of using birth control. One of the most common side effects associated with birth control is mood swings. The following information comes from the article by Andrew et al. The article begins by discussing depression as the leading cause of suicide deaths. It then goes on to explain oral contraceptives have synthetic hormones such as estrogen, progestogen, and testosterone. These hormones can work together to overall alter a woman's vulnerability to depression. Aside from oral contraceptives, some forms of hormonal birth control include the patch, the ring, the shot, the implant, and the hormonal IUD. According to Andrew et al., a study in Denmark indicated that women ages 15 to 34 who used oral contraceptives experienced an increased use of antidepressants. The next side effect commonly associated with birth control is headaches. Women have reported their contraceptives to have caused dull headaches to severe migraines. A study by Machado gives insight on this side effect. According to the article, the use of oral contraceptives is related to the intensity, frequency, and timing of migraine headaches. This information comes from 493 sexually active women ages 18 to 40 who use birth control pills being studied. 480 out of 493 women reported experiencing headaches, and 17% had at least five that were clinically considered a migraine. Women in the migraine group were more likely to report their headaches becoming more intense after taking their birth control pill. This shows that the hormones in birth control affect women both mentally and physically. The final side effect to be discussed is weight gain. Weight gain is perhaps the most popular side effect when discussing birth control. The article by Edelman focuses on the weight gain aspect of birth control. It states that weight gain is the leading cause of the discontinuation of birth control. The shot is notorious for causing weight gain, especially if a woman is not physically active. The hormonal IUD can also cause weight gain. Progestin tends to increase appetite, and high levels of estrogen can increase fluid or water. Increasing eating and decreasing physical activity is a main factor in explaining why some women experience weight gain with birth control. The variables for this research are age and weight. The first hypothesis in this research is younger students have a more positive attitude towards birth control. Young women are often introduced to birth control at a young age. According to the article by Douglas, the number of live births per 1,000 women ranging ages 15 to 19 has dropped 45% since the year 2000. Parents are choosing to introduce their daughters to birth control to avoid an unplanned pregnancy. Younger women are more likely to have a better experience with birth control. This is because in the age range of 15 to 23, they are more likely to be involved in physical activity. This could be in high school or college sports. As stated before, women are more likely to experience weight gain due to decreasing physical activity. Contraceptives may also have a long-term effect on women. An article by Gravelson et al. Explains that by their study, contraceptives have no role in affecting memory. According to Allen et al., the benefits outweigh the risks for most birth control methods in women over 40. This is something women may not be aware of, which can cause negative attitude towards birth control. This is what the research focuses on. The second hypothesis in this research is participants of lower weights have more positive attitudes towards birth control. Obese women are likely to have an unsuccessful experience with birth control. This is because it is less effective. This information was acquired from a podcast which consists of a conversation between Meredith Carson Daly and Dr. Edelman. A study by Boyce and Niederman found the following. However, there is pharmacokinetic evidence demonstrating that some hormonal contraceptives, such as the transdermal patch and levonorgestrel emergency contraception, may have reduced efficacy when used by women with higher BMIs. In addition, BMIs greater than 30 and combined oral contraceptive use are both risk factors for venous thromboembolism, resulting in an elevated risk among women with higher BMIs who use COCs. There is little evidence on how women who are underweight feel about birth control. This is another reason this research is important. The questions asked in this survey focus on women's attitudes, ensuring not to ask any medical information. The research provides information on how women feel about birth control overall. In conclusion, birth control has been known to cause hormonal issues in women. These issues include mood swings and depression, headaches, and weight gain. It is also known that women who are older in age can have more negative attitudes towards birth control. This research focuses on women's attitudes towards birth control. The first hypothesis is that younger students have a more positive attitude towards birth control than older students. The second hypothesis is that participants of lower weights have more positive attitudes towards birth control. The independent variables in this research study are the relationship between age and attitudes, as well as the relationship between weight and attitudes towards birth control. The dependent variable regarding both hypotheses is the attitudes towards birth control. This research is effective because it provides a better understanding of how women feel about birth control regarding its side effects. Participants in this study included 35 female undergraduate students at a Louisiana university. The ages range from 19 to 58. Participants were recruited using online platforms. This study included a questionnaire on women's attitudes towards birth control. The questionnaire was structured using Google Forms. There was a total of 11 questions utilizing multiple choice and fill in the blank answer choices. Refer to the appendix for the questions that were asked. This study utilized a correlational design because it is the best strategy to test relationships between two variables. Participants were emailed a questionnaire through Google Forms and asked to complete it. They were first asked to give consent to participate in the study. After completing informed consent, participants were asked demographic questions focusing on age and weight. Following the demographic questions, the participants were grouped by their specific age and weight. Next, participants in both groups completed the questionnaire, answering questions about their attitude towards birth control. Upon completion of the questionnaire, participants were instructed to submit their answers and close the browser. Scores below 3 considered a participant's attitude towards birth control as positive. Scores above 3 deemed a participant's attitude towards birth control as negative. To recall the hypothesis, the first states that younger students have a more positive attitude towards birth control. In this study, 35 participants completed a questionnaire and were split into two groups based on their age. Women ages 29 and under were grouped as younger, and women 30 and over were grouped as older. Based on 5 questionnaire answers, a score below 3 was considered positive, and scores 3 and above were considered negative. The mean of the age groups was 26. The youngest age was 19, and the highest age was 58. A chi-square test of independence was used to test this hypothesis. A 2x2 contingency table was set up to calculate. The relation between age and attitudes towards birth control was not significant. I have included an illustration of the formula used to calculate. To recall, our second hypothesis states that participants of lower weights have more positive attitudes towards birth control. As stated previously, 35 participants completed a questionnaire and were placed into two separate groups. Weights under 200 were considered lower, and weights over 200 were considered higher. A score below 3 was considered positive, and scores above 3 were considered negative. A chi-square test of independence was used to test the relation between weight and attitude towards birth control. A 2x2 contingency table was set up to calculate. Women of lower weights did not have more positive attitudes towards birth control, therefore, the hypothesis was not supported. And I have again included the formula to illustrate what the outcome was. The first hypothesis was not supported due to the significance level of the chi-square test being at p is less than 0.5. The p-value of this research was higher than 0.5. Younger women did not have more positive attitudes towards birth control. The second hypothesis was not supported because the p-value was higher than the chi-square significance level. Women of lower weights did not have more positive attitudes towards birth control. Further in this research, 82.9% of the participants reported that birth control has negative effects on the body, while 17.1% of the participants reported that birth control has positive effects. This is consistent with a previous study that reported 54% of women believe there are substantial risks with birth control, while 34% did not think there are substantial risks. This information came from Murphy et al. This study differed from the current in relation to the effectiveness of birth control methods. In the current study, condoms were reported as the most effective birth control method, while oral contraceptives were reported as the most effective in the previous. This research was important because there are not many studies on women's attitudes towards birth control. Although the hypotheses were not supported, this study can potentially aid in future research on this topic. In future research, a larger participant pool could result in more accurate results. There should be expansion in the number of participants as well as the ages of the participants. Another interesting study could focus on men's attitudes towards birth control versus women's attitudes. The following sources were used in this research: